Hello, this is Suzanne Kellner-Zink from Dung Vision's Hypnosis and Reclaim Your Practice in Your Life. Today I would like to speak about one of the main concerns that I have regarding the way that psychology and psychiatry is practiced these days. With the ever-widening inception of pharmaceuticals being put into play when people really only need to be able to understand why they have the problems they have and what they need to do to resolve those problems. And I'm going to tell you, after almost 20 years doing hypnotism and neurolinguistic programming, diagnosing is not necessary. Because as you all know, there's a lot of overlap in those diagnoses. And many times, people are diagnosed incorrectly. I found this out, I don't know, back in 1994 when I was working in a supported housing program where we had to update all of the charts for all of the clients who were living there. And I can tell you that quite a few of them were not really diagnosed correctly. We had one woman who had two distinct personalities that we saw working with her day in and day out, but yet she was diagnosed as a schizophrenic. She wasn't schizophrenic. She had two different personalities, and they were really clearly distinguishable. That's just one example. But we all know that people who have bipolar with psychotic features can look a lot like schizophrenia. We know that people with borderline personality disorder are sometimes seen as manic depressive, as bipolar, and vice versa. There's so many overlaps in categories that there's a lot of misdiagnosing going on, and it's really incredibly ridiculous because you can't treat a person if you don't understand what's truly going on with them. And this is most especially true of those people who have this label called depression. Depression's like pain. It's a symptom that something is wrong and we need to find the cause, and many times it's physiological in nature and has really next to nothing, if anything, to do with emotional distress. If your neurotransmitters are not being created because amino acids are not being metabolized, that's the cause of the problem. It's physiological, as are hormonal problems and side effects from medication. So we have to have a much more holistic approach to how we view the issues with which our patients and clients present in order to be able to help them truly heal. So maybe what we really need to do is look at each person, each patient or client, as an individual entity, which of course they are, and operate from that foundation. And from there, we can better help them to resolve their issues and problems. Because the reality of the situation is that human beings are like really complex, and it's not just the brain and the neurology or the emotions in which the neurology create. It's the whole physiology that works with the mentality and the psychology that allows people to be able to respond to the situations in their life in a healthy way. And this became particularly evident with one of my more complicated clients who had heavy metal issues. She had genetic issues. She had issues with the incapacity to metabolize her amino acids to make the neurotransmitters, which is actually found out a decade and a half later was based on genetics on both sides of her family. It had nothing whatsoever to do with emotions. And yet she is told by the so well-meaning psychiatric social workers and psychologists and mental health counselors she saw over many decades that she'd be on antidepressants for the rest of her life, even though none of the antidepressants ever took care of any of the issues, because that wasn't the basis Besides, if we look at the science behind them, we understand after 40 years of research that they really don't do that much to help the patients. Not really. Placebo, yes. More than that, no, because we're looking at the ratio of people who have outcomes versus those who do not. 30% is considered placebo effect. So I want you to really think about this from a very different perspective in terms of individualized care based on presenting symptoms, the reportage that your client or patient's giving you, so you understand the whole situation, not just the mental, emotional situation. Because in that way, you're going to be a hell of a lot more effective with many more of your patients going forward. And you're going to learn some pretty interesting things along the way, as I did with this particular case, which is a wonderful thing, truthfully. As always, I thank you for spending your time with me. Till next time, I hope you found that your time spent here was of great value to you. Bye-bye.